Hello students, let's quickly do recap of chemical regulation of respiration. Okay, as we know that chemical regulation of respiration, it involves chemoreceptors. Okay, chemoreceptors are very important. Name itself suggests that these chemoreceptors, they detect what? They detect chemical changes. Okay, in blood or maybe in CSF. Okay, so remember these chemoreceptors are of two types: peripheral chemoreceptors and what else? And central chemoreceptors. Again, we know that peripheral chemoreceptors, they are present in carotid body or sinus. It is body, yeah. It is present in carotid body and aortic body. Okay, it is present in carotid body and aortic body. What about central chemoreceptors? Remember, they are present in neurons of ventral surface of medulla or pons. Remember, it's medulla. On ventral surface of neurons of, okay, in neurons of ventral surface of medulla. Okay. Now, let's see factors which stimulates peripheral chemoreceptors. Remember, if there is increase in PCO2, how much increase? It is more than how much? Just think, it is more than 37 millimeter of mercury, which you will get in respiratory acidosis. At this time, peripheral chemoreceptors get activated. Okay, and when there is decrease in PO2, how much decrease? It is less than how much? Less than 60 millimeter of mercury. Okay, if there is less than 60 word is very important, guys. When there is less than 60 millimeter of mercury PO2, at this time peripheral chemoreceptors get activated. And when there is increase H plus in blood, okay, increase H plus in blood, which is nothing but your metabolic acidosis, at this time again you will get activation of peripheral chemoreceptors. So increase PCO2 more than 37 millimeter of mercury, decrease PO2 less than how much? Less than 60 millimeter of mercury, and increase H plus in blood. These three stimuli will stimulate peripheral chemoreceptors. Okay. Now, remember guys, for peripheral chemoreceptors, direct stimulus. Word is very important, direct. Direct stimulus is decrease in what? Remember, direct stimulus is decrease in PO2. Write it down. Decrease in PO2 is a direct stimulus for activation of peripheral chemoreceptor. Okay. And what about indirect stimulus? So simple. I know you know that. Okay. It is increase in PCO2 or increase in what? Only one is remaining, or increase in H plus. Okay, increase PO2 or increase in H plus indirectly stimulate peripheral chemoreceptors. Okay, and remember, most sensitive stimulus among these, increase PCO2, increase H plus and decrease PO2, most sensitive is, what do you think? It's PO2? No, it's PCO2. Yeah, it is increase in PCO2. It's very important, guys. Write it down. Most sensitive stimulus for activation of peripheral chemoreceptor is your increase in PCO2. Okay. Now, let's talk about central chemoreceptors quickly. We know that central chemoreceptors, they are located in neurons of ventral surface of medulla. You know that, and they detect chemical changes mainly from CSF. Okay, it's in medulla, that's why it detects chemical changes from CSF. So, if this is your section of brain, this is your pons, this is your midbrain, this is your medulla, then over here you will get your central chemoreceptors. Okay. Now, let's talk about stimuli for central chemoreceptors. Remember, whenever there is increase H plus in CSF, CSF word is very important, guys. Your cerebrospinal fluid is very important. Increase H plus in CSF is main stimulus. Okay, increase H plus in CSF, I am saying, not blood. Okay, so it is main direct stimulus. Main direct stimulus is increase H plus in CSF, not in blood, and increase PCO2 in blood. Increase PCO2 in blood is again one of the stimuli for activation of central chemoreceptor. And remember, this increased PCO2 in blood is a physiological stimulus. Physiological stimulus is increase PCO2 in blood. Main direct stimulus is increase H plus in CSF. Okay. What about decrease PO2 in blood? Remember guys, decrease PO2 in blood is not a stimulus at all. It is not a stimulus. Okay, only increase PCO2 in blood and increase H plus in CSF are stimuli for central chemoreceptor activation. Okay. Now, one most important thing you should know, that increased PCO2 in blood stimulates both peripheral and central chemoreceptors. It's very important. Write it down. Increased PCO2 in blood stimulates both peripheral and central chemoreceptors. So we can say hypercapnia. Increased PCO2 is nothing but hypercapnia. Hypercapnia is main stimulus or main drive for regulation of respiration. It is a main drive for regulation of respiration. So we can say this is as hypercapnic drive. It is hypercapnic drive. Okay, it's very important. So this was all about recap of chemical regulation of respiration. Thank you so much.